Greetings, everyone. Welcome to the 1947 Partition Archive COVID series. We are doing these specialized events with doctors and professionals from the medical field, specifically to answer your queries about the COVID crisis that has hit South Asia. My name is Vikrant, and I'm volunteering to bring you this episode. Joining me is Dr. Abhishek Roy. Dr. Roy is a respiratory medicine specialist, a consultant physician, a pulmonologist, and a diabetologist. Thank you so much, Dr. Roy, for joining us. It's a pleasure to have you.
Thank you, Vikram, and a very good morning to all and everyone. And I hope that everyone is doing fine, and everyone is hale and hearty. Thank you.
Brilliant. Thank you. Thank you so much, Doctor. So, just to dive straight in, given that you're the first pulmonologist we're getting the honor to speak with, and this crisis is completely, based on your lungs and your
Yeah.
respiratory system, I'd like to ask you a specific question. Do you have any concerns for patients with existing respiratory conditions and trauma, such as asthma, COPD, uh, interstitial lung diseases of any
Definitely,
kind?
Vikram. Definitely, Vikram. It's a very well question that you have asked me. It's a good question that you have asked me. We as a pulmonologist are always concerned for the patients who have already have a chronic lung disorder, whether it's being a parenchymal disorder or whether it being any airway disorder. Because what happened, we already know that priorly their lung immunity is already been compromised, so that's our main concern. And if you see the graph statistically, patients who have any chronic lung disorder, when they get COVID and post COVID, their residual lung function test and their quality of life has been compromised to a much severe extent in comparison to the patient who do not have any chronic lung disorder. So definitely, as a pulmonologist, our concern is always for everyone, but we have to be extra careful. We have to give some extra impact to all those patients who already have a chronic lung disorder, which may be in the form of airway disorder or may be in the form of parenchymal disorder. And even those patients should know that they also have to take some add-on precaution. Now, see, general precaution is being taken by the general public all over the world, like wearing a
Right.
mask, using hand sanitizer, maintaining the social distance, and everything. But those with already who have a lung disorder, they should take some add-on precaution. Add-on precaution in the sense what? To be very precise, for example, if a patient already has an asthma or if a patient already is a known COPD patient or a DPLD patient, first and the foremost, they should use their inhalers properly and on time and in the correct technique, because there is always a myth among many of our patients that we should not use inhaler. If we use inhaler, we will get addicted to it, and it will affect our quality of life, it will affect our day-to-day activities. But it's a complete myth, because for lung disorder, the best delivery medicine is in the form of inhaler, either in the form of MDI, that is the pressurized metered-dose inhaler, or in the form of DPI. So it is just a drug delivery system, and this is the real fact against the myth. Number one, and secondly, those patient has to perform their chest physiotherapy or their respiratory physiotherapy or lung physiotherapy, whatever you may say, on a regular basis, and they should get vaccinated not only against the COVID-19 disease but also against the seasonal influenza virus or the pneumococcal virus or the pertussis virus, because the lung biofilm in these patients are being compromised to a much greater extent, and they can catch any of the disease, whether it's been a bacterial disease or a viral disease or a fungal disease, with a slight intringent of a stimulus. So that's our main concern.
Okay. Okay. So I have one note to add here. You said that people with previous lung trauma need to be careful, even more so,
Very careful.
right?
Even
So
more so, yeah.
yes. So to all our viewers, I think what I can concur from what the doctor is saying is that even if you don't have lung trauma, but your loved ones or people around you might, please be extra cautious. Please make sure that you are taking every precaution you can, maybe because you can fight the virus easily enough, or it won't
Exactly.
be too bad for you. But for them, it's maybe two or three times as bad, and the chance of them ending up in an ICU or worse is much higher. So do be careful. Uh, Even though you might read that, yes, the COVID scene is kind of dying down now, please be careful if you're living with people who have lung trauma or any kind of serious illnesses, even diabetes, for example, right? And vaccinate
Yeah.
yourself against seasonal diseases, including influenza, but COVID vaccine first. Great. Another thing you said, doctor, I had a question. You said physiotherapy for the lungs or the chest. What is that? I
Yeah,
don't
lung
comprehend.
physiotherapy or the yeah. I'm telling you, lung physiotherapy or the chest physiotherapy. Actually, many of the patients which we encounter, they have a mild asthma or a mild COPD or a mild DPLD. So what happened? There are various lung physiotherapy. For example, you have been seen that in COVID patient, we give a very common exercise that's prawn awakening. So here, what we
Yeah.
tell that the patient have to be in a certain posture for 1 hour each. So what happened? It improves the ventilation and the perfusion ratio, as a result of which there will be an improve in the oxygenation. So for certain, there are many lung physiotherapy tests. Even you can see who are the post-COVID recovery patient, we give them an instrument like which is being widely been known and and it's now very familiar with the general population even itself, that the incentive spirometry. So what does it does actually? Actually it expands your lung, because what happens in pneumonia, in SARS-CoV-2 pneumonia or in any pneumonia, what happens, a thin biofilm forms across the alveoli that will hamper the gaseous exchange at the alveoli capillary blood membrane at the lung interface. So what happens, you have to break that biofilm, you have to break the shell, so that the alveoli can again inflate and deflate accordingly, and as a result of which there will be no infection within it, and the lung, and there will be no air trapping within the lung. So these are the lung physiotherapy which we mean, like prawn awakening. There may be some aerobic exercises, there may be some restrictive exercises, even there will be the use of incentive spirometry, even and the most important thing is which I do prefer is the happing or the clapping. There are certain medical terms which we use, and these are the lung physiotherapy which we most often, not most often, every time we do prescribe a patient. So these are very important in case of COVID too.
Okay, okay. So, so basically, by doing these exercises in a layman's term, what I understood is you have your alveoli, and there's like a laminate of infection around it. And when you do these
Exactly.
exercises, it tears the laminate so your lungs can function properly. That's
It can function
basically it.
properly. Yeah, that's the basics. Yeah, that's the basics.
Simple terms, but so important because they're like
It's
they're the
very
things that
important.
help
It's
us
very
breathe
important.
and they
It's
help
very
us live.
important.
Okay,
Yes, sir.
thank you so much.
Yeah. This is
Great.
also a myth, Vikrant, that as you have a lung disorder, you should not do the exercise, you should not do the yoga, you
Okay.
should not do the lung physiotherapy. So the fact is that you should do it. You having asthma or COPD doesn't mean that you should not lead your day-to-day activities. You can do everything. You can go along with aerobic exercise. You can do swimming. You can do cycling, but to a certain limit. You should not cross your limitation. You should know when to stop and when to start.
Understood. Understood, doctor. Thank
Yeah,
you. Although, okay, so we've noticed that we had a COVID researcher, somebody who helped with one of the vaccine studies, come on, and she said that the doctor, she said that every couple of months we're learning something new about this disease. All right, and I'm sure you agree as well. And I know
I
it's
do
still
agree.
early. It's still early, okay? But I'd like to know from your perspective, do you think there are any lasting effects of COVID-19 on the lungs? Because I remember
Definitely,
you
there are.
saying it previously.
Yeah. Definitely, there are lasting effects of COVID in the lung, especially if that lung has been compromised prior. For suppose, I'm giving a very short example. Suppose if a patient, suppose I get a case where a patient already had pulmonary tuberculosis, maybe 10 years, 5 years, or 20 years back. So his or her lung has already been compromised, right? Now, again, that patient is having the COVID or SARS-CoV-2 pneumonia to any extent. It may be a mild or a moderate, but the symptoms will be more in case of such patient because the lungs has already been compromised in this case. So one of the most notable findings that we find in the post-COVID recovery patient is lung fibrosis. So what happens once fibrosis encountered within the lung parenchyma? There is no way out. We are not
Sorry,
going to
sorry.
regain fibrosis.
I'm sorry.
Fibrosis.
What is that? What is fibrosis?
Yeah, fibrosis means that part of the lung cannot be aerated. That part of the lung cannot take part in the gaseous exchange. It's the wastage. It's the wastage part of the lung. That part of the lung is not working. At that particular part of the lung, the alveoli or the airways, it's not working. It will not aid you in oxygenation. It will not aid you in respiration. It will not aid you in diffusion. The main two functions of the lungs are diffusion and respiration. So that part of the lung is totally been damaged. And once fibrosis is being encountered, we are not going to get back that lung for sure. It's not possible unless you go for lung transplantation, which is not being feasible for the general population or for the general mass. So one of the most important concern is the fibrosis. And secondly, what I feel is that once fibrosis is being encountered, we have no way out other than some symptomatic management. So we have to start it from the very beginning. If the fibrosis is very mild, then also we can improve the quality of the patient to some extent. But when it aggravates, or if it takes, or if it involves a greater portion of the lung, and further if that patient's lung is also being damaged previously, then there is no way out. Then his quality of life is going to affect very severely. And even I'm not sure also whether such patient can lead a very run forth healthy life in the certain future. So I'm not very sure also. So that's the main
Okay.
concern for us. Yeah.
Okay. Understood. Understood.
Yeah.
All right. Given the whole you know standard of living for these patients, right? I
Yeah,
want
yeah,
to
yeah,
take a
yeah,
step back and make sure we cover all our bases, okay? And what leads us to a lower um quality of life, right? So from with COVID,
yeah,
we've seen that a lot of doctors say that there's some kind of after the early stages, that's when you're contagious, and then you kind of get inflammation in your lungs, right? And
yeah.
that's what's the serious bit
I'm
because
telling
your
you,
body's
I'm
fighting
exactly, Vikram. I'm telling you,
what?
for every
Yeah,
infectious disease, that there is a cycle, right? Firstly,
right.
you are exposure to the pathogen. The pathogen invades your body. That leads to infection. As a result, the body will try to defense against the invading pathogen by releasing some inflammatory cytokines or some inflammatory markers, because body wants to protect us. So that's the defense mechanism for the body. So as a result of which there will be a fight between the pathogen and your body. Okay. As a result of which there will be certain releasing factors as a result of it. Either it will be going towards the good thing or it will be going towards the bad thing. Right. There will be nothing in between. And then after that, we seek our doctor consultant, we take the prescribed medicine, we do all the necessary intervention, we take all the necessary intervention, and then the disease subsides. Before leaving the disease will leave some residual effect. Now that residual effect, which I want to make an impact for patient who already have a prior lung disorder or patient of chronic lung disease, that residual effect will be of greater significance for those compared to the other people who don't have or who have a healthier lung. This is the main gist here, Vikram. Now, talking about the inflammatory markers, Vikrant, which you tell that in COVID, there are many inflammatory markers which aids us in the disease, and those markers generally they come or they have an achievable level or a good significant level from day 5 to day 11 or day 12, with a peak rise in day 8. And those markers not only help in assessing the severity rate of the disease, but it also tells about the prognosis of the disease. And those markers, which are the some of the most important common markers, are the CRP, the D dimer, the LDH, the procalcitonin, the serum ferritin, along with the liver function test, along with the renal function test, and along with the count. So these are the most important inflammatory markers that we use in COVID.
Understand. Okay, doctor. So,
Hmm.
to fight these, to never get to this kind of stage where where you get these markers, I feel like
Yeah,
getting vaccinated is super important, right?
yeah.
But there are certain myths, especially with patients who already have certain lung conditions, that if you get the vaccine, XYZ will happen to you. Don't get it. Just stay at home. What as a specialist and as a person who's on the field every day battling this disease, what is your word of advice to these people?
Actually, Vikrant, to be very honest, there are various myths which is being circulated against the vaccine. The myth and the fact are being widespread and so widely being prevalent among all the general population. I don't know from where they get these things, or who are the media boxers who are being propaganding it on a wider scale. First myth is that patient thinks or the people thinks, if I get vaccinated, I will not get COVID. This is the first myth. See, vaccine will not prevent you from getting the disease, but vaccine will prevent the disease on a lesser severe level. That is, taking vaccine, it's not being mentioned anywhere that you will not get the disease. You may get the disease, but the after effect of the disease will be of milder effect. You will get the disease on a less severity level. It will be not as severe if you had not been vaccinated. First is this one. Secondly is that there are many vaccines being widely being available in the market, and in every country has recognized or have considered its own way of vaccine. Every vaccine is effective because all has gone through the phase 4 and the phase 5 of the marketing trial before being launched in the market. So all the vaccines are equally effective. Now it depends upon which country has chose what vaccine would be necessary according to their developmental status, according to their financial status. It's personally, it's their thing. But what I feel is that every patient should get themselves vaccinated unless they are absolutely contraindicated to vaccination. Now, see, relative contraindication, the patient may not get vaccinated for a temporary time being. For example, a pregnant patient, they may not get vaccinated for temporary time being. That too on the first semester, semester is on the on the first trimester itself. But in the second trimester and third trimester, they may get. So what I feel, if a patient, if any patient has been absolutely contraindicated to any of the vaccination, they may not get. Or else, I urge to the entire world that you must get yourself vaccinated. And about other myths which I want to tell over here, that if you get vaccine, you may not step out of your house. This is a fairy tale. After getting vaccine, you should observe yourself for at least 24 hours or for at least 72 hours. But these are all irrationally. These are very irrational things. I don't know from where such things circulate, because even we, the health workers, we get vaccine, and immediately after taking vaccine, we are resuming our job. So what does it mean? That if something being was being proposed, and then it would have been restricted to a certain section of the population, that they should take the
Yeah,
vaccine and they
yeah.
should quarantine themselves for 72 hours or 24 hours. They may observe themselves. Then what about us? We are also the human beings. Our body system is not at all different from the other system. So it's nothing. What I feel is that unless you are absolutely contraindicated, go and get yourself vaccinated. That's very important. But at the same time, you should remember, vaccinated doesn't give you a guarantee that you will not compact with the disease. You will not contact with the disease. It will only assure you that even if you contact with the disease, it will be of a much less severity. The severity
Okay,
level will be of much less.
understood. Understood.
Yeah.
So for all our viewers who might know somebody or who might personally be going through a lung disease, as the doctor said, it's okay to get vaccinated, and it's actually better than okay. It's great to get vaccinated. Please, please do it and promote the vaccination amongst your society and amongst your community. There's nothing wrong with them, any one of the vaccines. I'd
Absolutely.
like to speak about fighting against all odds with
Yeah.
you, doctor, right?
Yeah.
Because of this whole myth busted idea. Can you give me a better understanding of it, please?
Fighting about all the odds. Firstly, I'm coming. See, what is happening that once there has been, we are noticing once there is a surge in the cases on a higher level, the general population is being very cautious at that time. That time they are maintaining all the that time they are taking all the precautionary measures. But apart from that, once we are seeing that there is a decline in the cases and there is an improvement in the recovery rates, we are taking it very relaxingly. We are mixing everything very socially, and we are not following the norms and the regulation. Now this is the most odd which I have felt over here. See, when a disease has been declared as a pandemic, okay, unless the pandemicity tag get over it, we have to be cautious. It's not that when the cases are rising, when we are experiencing any wave, we will take some extra measures, or when the cases are declining, we are free to toil here and there, or we can free to loiter here and there without maintaining any of the norms and the regulation. So this is the first odd which we have to find out. If we have to fight against this disease, we have to fight it together, and we have to fight against it throughout the year. It's not that whenever there will be surge, we will take some extra precautionary measures, and when there will be a deep in the surge, we will have a very relaxing thing. We will take some relaxatory measures, some relaxation in any sort. So that's a very bad thing over here. And secondly, what I feel is that certain section of the people, still I don't know what's the reason behind it, socially acceptability. Now this disease is not being socially being well acceptable. Initially there was a lots of phobia, lots of panicky among the people, but now it has been to a lesser extent, but still it's being widely being prevalent. What I've noticed, if you get COVID, you always try to remain yourself within the nut. You don't want to come out of the closet that I have COVID. I won't tell this to my neighbors. Otherwise, what will happen? They will segregate me. They will sideline me. Now, these do things happen in the rural areas, especially on, or not even in the rural areas, even in the urban side. If someone in the apartment gets COVID, okay, let's segregate them. Let's not talk to them. Let's segregate them. Let's keep them aside because they have COVID and it's highly contagious. It's like that. So these are the things. So we have to assure that yes, you take the necessary restriction. It's better you be quarantined if it's a mild case, or in a moderate and severe case, you get yourself hospitalized. But don't segregate them, because it will affect them mentally very badly. And you have noticed one thing: most of the COVID patient or the post-COVID patient, they are suffering from severe depression. And the foremost reason for this depression, apart from the phobia, or apart from the pathogenicity of the disease, apart from the outcome of the disease, is the social boycott. The social boycott, because any disease, whether it may be a simple common cold, if you get that mental strength and that determination, you can fight against it. So unless, but when a patient gives all his urge to fight against any disease, it's very difficult for any doctor to cure that patient. They should have their own willpower, they should have their own determination to fight against the disease. So it's a request to everyone that whenever you hear any of your neighbors or your fellow beings or your colleague getting COVID, you may at least can give a call to them, or at least can give a call to them. You can give some sort of mental support to them. Ki, yes, it's just a disease. It's just a matter of some time. You take the medicine, you take the precautionary measure, and you will be all right. You will come back with a bang. So that's the thing. And the
Right.
third, which I've noticed, yeah, and the third, which I've noticed is when in case of the severe cases, and see, now everyone can't afford a very private hospitals, right? Everyone can't afford a
Mm,
private,
mm,
there is the cost effectiveness in this. And
yeah.
in India, I must say that 80% of the people comes from the middle class or from the lower middle class family. So though the government has taken lots of measures regarding the treatment protocol, so that they can get all the new advent techniques and all the new advent technique in the government hospital itself, but still it's not been possible for the hospital to make it on a larger scale, because the doctor or the nurse is to the population ratio is much higher in India compared to the other country. So there we are facing a bit lacuna, but I hope that before the third wave, we are taking all the necessary measures so that we can combat it, and we have to prepare ourselves for the third wave. And there are also some many other myths, like the third wave is going to affect the children toll, it will spare
Mm,
the youth
mm,
or the middle aged or the older one. It's nothing. The disease, I have told them, in the coming days or with each and every day, we are understanding it more and more, and this is true for every disease. If you go into anything, you will understand it more and more. So these are all the myths. We have to prepare for the third wave, and it's not that the third wave is only going to affect the children, and other population or the other section of the people is going to be excluded from it. These are all sheer a myth and nothing else. Be prepared, be very much concerned ki what we will do when the third wave will come. We have to be very much ready prior only, before the arousal of the third wave or before the third wave comes. So these are the certain compacts and the odd things which we must fight against the disease. And one more thing which I have noticed, that post COVID, or once if a patient get COVID, he also has a false belief that I have got the COVID, I have got the protecting antibody within myself, I would not catch the disease for the next time. Here I want to get it here. See, you got COVID, your virus has a specific variant, so you got antibody against that variant, but there is no guarantee from any part that you won't get affected by the other variant. So
right.
don't be in the falsehood that you will not, once you have got COVID, you will not get COVID another time. So this is also a myth which is being widely being prevalent among us, and that has been circulating in most of our mind. So these
I
things
understand.
has to be get out. We have to
Okay.
get rid out of such things.
I'm so glad that you covered the third wave phenomenon, because it's been now all over the news and people have been wondering whether it's a fact or a myth. Thank you for letting us know
Yeah,
that it's a fact and we must prepare ourselves. Something
yeah,
that I picked up from what you said is the 2 points of counterproductivity would be shunning people, because then they won't tell you. And if they're not
yeah.
telling you, then you're not prepared for, taking extra social distancing precautions.
Obviously,
So don't
obviously,
shun people,
obviously.
right?
We have to take
And
the
the other
people
one,
into confidence. Yeah,
exactly, exactly.
yeah,
And the
yeah.
other one being, if you're seeing cases dropping today, it's from the precautions you took 2 to 3 weeks ago. So if today you
Exactly.
start to go out, it's very counterproductive to the work that you've been putting in, because 2 to 3 weeks from now, by the time the statistics come out, you might have already, or you might have given the disease to somebody who's highly susceptible, like the people we spoke about earlier, right? So, as you said, uh, to all our viewers, as the doctor specifically said, until the pandemic status is not removed from COVID-19, please continue to take all the precautions that are necessary and get vaccinated. That is it from me, doctor. If you would like to add anything else.
Absolutely. Just I want to say that unless the pandemic status, because the whole world is battling against this disease. It's not an endemic disease. It's not an epidemic disease. It's a pandemic. Pandemic means on a larger scale, and we have
Right,
to clear it out from the grassroots level, because
right,
every pandemic disease we fear one thing, that the disease doesn't go and stay into as an endemic disease. We don't want that. We don't want to live our entire life, or we don't want to see our successor generation to live with the COVID. We don't want this thing. We
mhm,
want a COVID free world, right? So we should maintain all the precautionary measures irrespective of your vaccination status, whether you being vaccinated or not. But unless the tag is there as a pandemicity, unless it being labeled from WHO as the pandemicity, get the precautionary measures, take the extra precaution. Don't don't let yourself lose into unnecessary relaxation and into unnecessary social mixing. So these things should be avoided from that part. Every netizen of the country should also take a part in combating the disease. It's not only the health workers or the other volunteers who are being associated with the COVID. Only they will fight against this disease. It's a responsibility for each and every netizen of every country all throughout the world to help each and everyone and to be united and to fight against the disease. Then only we can achieve our desired goal. Yeah.
I understand. Yes. So, so actually, before we end, exactly what you said. But I was speaking to an elderly gentleman who's a mutual acquaintance of ours through the family, and he's in his 70s now. And he told me there was a point when he was younger and they had to stay indoors for a very long time, not as long as this COVID has lasted, but
COVID.
due to a specific different situation, they had to stay indoors for a very long time. And he said, it seemed like hell. But now that I'm in my 70s, I thank God that me and my family remained inside because if we wouldn't have, I wouldn't have reached my 70s. So you're so right, and they wouldn't have had their kids. And that's, you don't want your children to live with this disease and their children to live with
Exactly.
this disease, right? So it's difficult. I agree.
and
And
we
I'm
can and we can
sure,
also consider and we can also consider this quarantine as a boon from God. So we also are getting some extra time to spend with our family, because
sure. Yes,
every one of us are so busy with our each and own career that we doesn't even
yes,
get time to take a one meal all together in the dining table too. But now this
yes,
pandemicity and this COVID has taught us many things, right?
yes,
And the first and the foremost thing which I must say, that everything in life is very substantial and is very temporary. So nothing is permanent in life. So we can also take it as a boon that
yes,
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 we are all together. We are spending a good time at our home. We are doing our work from home. So the scenario has changed, and yes, and hopefully in the coming days we will be get along with this. We will understand more about the disease, and and soon we are going to get a COVID-free world. That's all.
yes. That's the hope.
That's all we.
Uh,
Yes, that's the hope, and we have to be positive about that. Yeah.
yes. And thanks to, warriors like you, people like us get to stay at home and work from home and not worry so much. Thank you so much for your support. Thank you so much for coming on the show today, Doctor. We really
Thank you.
appreciate
Thank
it.
you. Thank you,
For
Vikram.
all our viewers, we will be hosting more specialists on our channel on YouTube and Facebook. So to keep updated, kindly subscribe and have a safe day. Take all social distancing measures. Thank you so much for joining us. Thank you.
Thank you.